Good afternoon. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'd like to welcome you to the third floor conference room of Waco City Hall for our weekly press conference where we delve into the issues of COVID-19. We're all dealing with this, and certainly we have experts that we'll be talking about. We're observing social distancing here in this room. We only have two people. Julie Olvera from the City Secretary's office is handling our Zoom meeting, and that's all we have here. But down in our first floor studio downstairs, we have an American Sign Language interpretation going on for that to be able to insert it into the image so we can share that with anybody who needs those services. And we also are recording a Spanish translation in audio in our studio, and we will then take that audio and lay it over the video of this conference and re-air it this afternoon at 4:30, where all of our Spanish-speaking population can be able to benefit from the good things that we're going to hear from there. And always so sweet and nice and wonderful, I guess is the good words, to come and invite our Hispanic audience is our new, I'm going to congratulate you, Mayor Pro Tem now, not just District 2, but Mayor Pro Tem Hector Sabito. Hector, would you invite our Spanish-speaking audience?
Absolutely, Larry, and thank you again for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante la conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, as always, thank you so much for allowing me to be here.
Well, thank you for joining us and taking time out from your busy workday as it is. Thank you again. Joining us in our panel today, a little bit different makeup than what we've had. Of course, we do have our new mayor, Dylan Meek. We also have from the Family Health Center, Dr. Ben Wilson, from the Family Health Center, and we have Dr. Brian Becker from Ascension Providence, and back again is Dr. Mark Eliason from Baylor Scott & White. Gentlemen, always appreciate your coming. We're short. The judge is busy with other things today, but it's great information. We're going to run the routine much like we always have. We'll ask each one of you to make an opening comment. Then we'll have the few questions. We didn't get that many this time from the media prior to this, and then we'll open it up. We do have 3 media representatives waiting on the line that they'll have a question, two questions each that they'll be able to ask, and then we'll ask our mayor to make some closing comments. So let's start off with opening comments. We'll start with Dr. Ben Wilson with Family Health Center, follow Dr. Brian Becker of Ascension Providence. After him, we'll have Dr. Mark Eliason, Baylor Scott & White, and then Mayor Dylan Meek. So let's start off with Dr. Ben Wilson. Dr. Wilson.
Yeah, thank you, Larry. Thank you, Mayor Meek. Pleasure being here again with everyone else. I've enjoyed doing these in the past. And so I have some opening data. I guess I'll introduce myself first just a little bit. Again, from Family Health Center, and I'm Associate Chief Medical Officer there and COVID Coordinator. So opening data here is, these are just McLennan County numbers, the most updated that we have. We have had 125 new cases in the last 24 hours. We are actually reporting 426 new cases in the last 24 hours, but 301 of these are delayed reports from prior dates. A little bit of a data dump, which has occurred from time to time throughout the pandemic, as many are aware. As far as overall surge testing cases done, there have been 29,828 tests done at the surge testing sites. Total cases to date that we've had in McLennan County are 15,880. Active cases, 1,284 currently. On vents, 23. And total deaths to date are 227. It was 203 last week. And so 24 in the last 7 days. And actually, I'm going to expand my slides here so you can actually see the slideshow. Great. Now, as far as McLennan County, there we go. Okay, can you all, I have 2 things here. Can you all see McLennan County active cases? Oh, no. Here we go. Here we go. There we go. McLennan County active cases. Currently, as I said, there's 1,284 total that are active. In the nursing homes, there are 82. In the jail, there are 5 cases. And in the schools, there are 180 active cases. The breakdown on that is there are 97 students with COVID currently and 83 teachers. All right, so this is Dr. Griggs normally presents some awesome graphs and multiple graphs. I have combined a lot into one graph, but the data is current. So let's go through this. This is new cases per day per 100,000 people. And if we have, I'm just going to say 240,000 people in McLennan County, then you can sort of extrapolate this data a little bit, given that it's new cases per day per 100,000 people, and it's a 7-day rolling average over the last 7 days. So as you can see, it starts in June, and we go all the way forward to the data is current as of yesterday, December the 8th. So really, I'll direct your attention to the right of the slide here, and that is the activity that has happened within the last week. As you can see, the three lines are US, Texas, and McLennan County. In all three cases, US, Texas, and McLennan County, that the cases per day per 100,000 are rising. And so we had a little bit of a drop, which I'm wondering is related to testing numbers from Thanksgiving, just me speculating, but it is definitely going up as far as cases reported, and activity of COVID appears to be increasing. This red, orange, yellow here, we are above sort of the tipping point, or this is kind of a almost literally a code red, meaning that things are just not good as long as we're in this red territory. And so that's the take home point from that. We see accelerated spread when you have anywhere from 10 to 25 cases per day per 100,000. Well, we're well above that. And so everyone needs to be paying special attention to all the measures that we have discussed from the very beginning on how to prevent further cases. I don't have a slide or a graph for this rather, but the positivity rate, 7-day rolling average, is now 14%. It was 11% last week. So that too is increasing. And here is just a graph of COVID-like illness at Family Health Center. I won't get into, we'll not get into how this is defined, but it's a lot of what you would think, cough, cold, runny nose. And the question is, how much of that are we seeing versus the last 3 years on average? And so the red line is this year. The blue line is an average of the last 3 years. As you can see, for much of the past 3 to 4 months, our cough and cold volume at Family Health Center, and we have 60,000 patients, is definitely increased over the average of the last 3 years, thanks to COVID. And also possibly because people are seeking care for their cough and cold more, which we would hope that they would. Here are the current hospitalizations, the most recent data that I have. This is per 100,000. This is US, Texas, and McLennan County. US is up a little bit this week. It was 29 last week. Texas is the same. McLennan County is up from, I believe, 39 last week to 42 this week. This is cases or hospitalizations per 100,000 once again. So what can be done? I left this slide in from Dr. Griggs' slide set from last week. We just continue to hammer the take-home points. Wear a mask, put it over your nose and your mouth. A mask is better than a face shield. Wear the mask indoors and outdoors. I'll add that little point. Stay home as much as possible until the surge subsides. Only essential or critical type gatherings would be the main ones that we would prefer, that we would say are acceptable to go to. Anything else is, if you can avoid it, it would be best to help halt the spread of COVID. Avoid drinking and dining inside a restaurant or a bar. And we know that these are high-risk activities. Although we know that this far into the pandemic, people are frankly getting tired of this. And I think all of us feel it. The fatigue, the chronic the chronic anxiety, the chronic fatigue, having to pay attention to these preventive measures that are difficult to do, frankly, but they make a huge difference. And as usual, 6 feet distancing from all non-household members. The further away that you are from someone, but at least 6 feet, the better. And that is all I have. I'm going to stop my share. Thank you, Larry.
Thank you. Okay, let's go to Dr. Brian Becker from Ascension Providence. Dr. Becker?
Good afternoon. Thank you again for having me on the press conference. Again, I can speak for Ascension Providence and what I see within our facility, and then in some general terms for what I see in our community. Our numbers in general over the last week have been pretty flat. Actually, over the last 2 or 3 days, we've actually seen a little bit of a decline in our hospitalizations. Minimal, but it stopped climbing at least. So I'm looking at that as a ray of hope. I'd like to think that that has something to do with people being safe over Thanksgiving. That effort that people put in to limit their gatherings or eliminate them altogether, to be certain that they were safe if they did participate. I am hopeful that what I am seeing in our facility is a reflection of that activity. So kudos to our community for making an effort in that sense. Certainly, as we see higher hospitalizations, the question of capacity and our ability to take care of our patients becomes, in our community, becomes a question that people ask. I get that question, as does every other member on this panel, I'm certain. I can tell you that we are currently functioning under normal operations. So we haven't moved into our surge plan at all at this point. We have a tiered approach to what would we do as volumes begin to climb. We have had constant communication across this community on what does surge capacity look like and what can both of the hospital systems, FHC, and our health department handle. What does an alternate care site look like? So those have been conversations that have been ongoing since February. And there are constant reiterations of that and refinement of what does that look like. So I think the actual facts of what does each of those tiers look like changes, and it changes over time. It changes with what does staffing in our hospital look like? What's the availability of ventilators? We have almost doubled our ventilator supply. So we are nowhere near tapping out the ability to handle patients who show up at our facility and need care. So I think it's important for our community to understand that we still have a great deal of reserve and capacity to take care of folks if they get ill. Other things of interest, we are working on plans for distribution of vaccine. I'm sure everyone's aware that vaccine distribution is slated somewhere in the coming week to week and a half. How that's being distributed has been decided by others outside of this community. It's been decided by at the state level at this point, as has who gets those vaccinations. Those plans are set in motion, and our task is really to figure out how to implement those plans. So we've been working on that of late, and with still more work to do. We did begin monoclonal antibody infusions over the past week and have administered some of those doses as well for folks who are COVID positive but not sick enough to be in the hospital and early in their course. There is some hope that that's going to be a useful tool for us. It is under investigation at this point in time as emergency use authorization, but it does potentially have some hope for folks as a reasonable tool. I want to continue to encourage folks to socially distance and wear a mask. As Dr. Wilson pointed out, those are critical for us, and I look forward to questions. Thank you for having me.
Thank you again. Okay, let's go to Dr. Mark Eliason with Baylor Scott and White Hillcrest. Dr. Eliason?
Yeah, thank you, Dr. Becker. So similar comments because similar questions and similar issues at Baylor Scott and White Hillcrest. Front and center in front of people's minds as we've seen this large surge in the last month with new COVID cases and increased hospitalizations. What is our capacity? And so we continue to have open space within our hospital to care for COVID and non-COVID patients. We have plenty of ventilators at this time, and we are continually in tandem with the county health department and with Ascension Providence and within other hospitals within the Baylor Scott and White system are evaluating what we can do to help expand our capacity. Again, we're not there yet, but should we get tighter, we're working continually daily on reevaluating our surge plan and how we can meet that demand. We are fully committed to caring for Waco and McLennan County patients right here at home. And at this point in time, I do not foresee the need to deny care to anyone who needs care right here at home. And as Dr. Becker said, also, we are excitedly anticipating receiving vaccines within the next 1 to 2 weeks. The state is delivering those. And as Dr. Becker said, we have clear mandates as to what that process is going to look like, who receives the first rounds and that sort of thing. We are excited because it's an extra tool in our tool bag. Up until this point in time, we've pretty much been focusing on preventive care in the community, which includes hand washing, social distancing, and then that mask that covers both the nose and the mouth, right? Not just the mouth. So we have an extra tool in our tool bag. And then as far as treatments are concerned, yes, we've been administering monoclonal antibody infusions and other medications right here. So one more comment too, because we have had nearly 16,000 cases in our county, which means there's a lot of people who have experienced COVID in some degree or another. Some people fortunately have a very mild case, minimal symptoms, and then some people come very close to death and some even succumb to the illness. But fortunately, only 227 people in our county have died from COVID, which means we have a huge number of people who have been sick and recovered. And the illness does provide some protection for some time. We know that for at least 90 days, those antibodies that your immune system creates will stick around and provide some degree of immunity. But after 90 days, we know that those antibodies begin to disappear. Now, there is still some immune response when you're re-exposed after those 90 days, but you still can get sick again. A dear friend and coworker was one of my first patients in the hospital early on in this illness, and she had a very difficult course. It took weeks and weeks to recover, and she's contracted the illness again many months later. So reinfections are not common, but they can happen. So again, a word to the wise: if you've had the illness, do not think you were Superman or Wonder Woman. You can get this again, and so it's important to continue to be cautious, social distance, wear your mask, wash your hands. But we do eagerly anticipate that vaccine on its way. I'll stop there for now, but look forward to participating further as we go.
Okay, thank you, Dr. Lyson. Waco Mayor Dylan Meek. Mayor Meek?
Good afternoon. Thanks to everybody for taking time to join us today. And I want to thank the local doctors on this call. I definitely believe that we can trust our local doctors, and I'm thankful for their very good advice that they give us every week. Some of the subjects we want to hit today that have already been hit are hospitalizations and vaccines. One of the data points that I want to look at first is our hospitalization data. And Julie, if you could pull that up on the screen for us. Let me know when you get it. There we go. The blue line on this chart is the number of hospitalized patients, and the orange line is the number of patients on ventilators. We have 107 hospitalized patients as of yesterday, with 23 patients on ventilators. This is a data set that continues to climb here locally, and we've been hovering above the 100 mark for the last week, somewhere between 110 and 107. You'll remember last week we just crossed that 100-person hospitalization threshold. So we've continued to see this hospitalization rate grow. And we've seen an increase in ventilator use. So again, this is a moment of, as Dr. Lyson and Dr. Becker referenced, I'm thankful for our hospitals working hard to ensure that we have capacity. It is something to be cognizant of and to heed the advice that's already been given on this call about how to reduce hospital capacity concerns. I spoke with a doctor recently who gave me some good advice, and that is that based on the rate of spread in Waco right now, it's safe to assume people that we come in contact with currently are asymptomatic but carriers of this virus. And I think that there's wisdom in how we approach people right now. We live in a country that believes strongly in our right to make our own decisions, and I believe that as well. But we have to recognize that we make decisions that affect others. Some of those most impacted are our doctors, our nurses, our healthcare providers who have been working tirelessly and continue to see this rise in hospitalization rate. So I want to take a moment to thank them. I also want us to be cognizant of the impact that we have as we spread this virus, both on the individuals that might find themselves in a hard position in a hospital, as well as the healthcare providers that have been walking a long road to care for them. So there's another thing I want to remind everyone of. Texas mayors and local governments have almost no policy-making authority. Governor Abbott has implemented and has control of the regulations and mandates, from wearing masks to closures of bars to occupancy requirements of businesses. The governor has issued an order stating that myself or local governments cannot issue more restrictive orders than what he has. Right now, as our hospitalization rates have been climbing, our city staff, our county judge, myself, hospital system staff are in very close contact and regular communication with one another to ensure that we're monitoring data regarding capacity concerns, and working with hospital personnel to make sure that they have personnel issues needs met. Our hospitals and the Wake and Clinton County Emergency Management Office have developed really robust plans to make sure that our population will stay safe, as the doctors on this call have already said. As I said last week, the Waco McLennan County Emergency Management Office has preemptively requested and received a refrigerated trailer from the Capital Area Trauma Regional Advisory Council to be used as a temporary morgue. However, at this time, there are currently 4 remains in the morgue. The mortuary service that handles most of the cremation and embalming for the majority of the funeral homes in McLennan County and surrounding counties is the one that has experienced capacity issues. The other funeral homes are not currently experiencing any issues beyond the normal increase that it sees at this time of year. I'll end again by saying that this is a time of hope. As Dr. Becker and Dr. Eliason pointed out, more positive news comes out every day regarding exciting new treatment opportunities and vaccines, and Waco is hard at work to make sure that we are prepared for the doing our part to make sure that we're prepared for the distribution of these vaccines. This is something that is we're learning more and more as a community every day, as there are many decisions being made outside of the control of local governments. But what I want our community to do is take heart that we have great people in our hospitals and our healthcare providers, as well as our public health office and our Office of Emergency Management, to ensure that this community is doing everything it can to be ready for that day to come. I also want to give a brief moment to take another group of people impacted by this pandemic, and that is our business community, who's experienced unprecedented challenges in this year. And I just want to give take a moment to thank them for their commitment to our community as well. And as members of our business community might continue to face challenges, they are able to visit covidwaco.com to learn more about business resources that are available for them. In these last many months, we have learned so much about how to take precautions against this virus. And I believe that the doctors on this call have given us great counsel on smart and safe behavior that allows us to go about our lives as normal as possible and without fear. So I would encourage us to exercise wisdom in the days ahead, to heed the counsel of the doctors on this call, as well as their own personal care physicians. So again, thank you for your time, and I look forward to the questions.
Okay, thank you all for that. All right, we get into the questions. We have a short list today. How are smaller regional hospitals in our trauma service area coping with increase in cases?
I do have an answer to that from the executive director of the Central Texas and Heart of Texas Regional Advisory Council. And that is yes, they are currently able to handle what they are seeing. While they do all have COVID patients hospitalized, the data that, or the response that I've been given is that they are able to handle the patients at this time.
Okay. Okay, details on vaccine distribution are sparse so far. What do local officials know about the rollout?
I'll start with this, and then I would welcome any of the other doctors on this call to jump in if they have additional information to share. What we do know is that DSHS did announce that our 2 hospitals in Waco have been each allocated 975 doses to be available as soon as December 14th. The FDA is set to meet tomorrow to review the emergency use authorization for the Pfizer vaccine in December 17th. For the EUA on December 17th to review the EUA for Moderna. Both manufacturers already have vaccines produced and are ready to ship as soon as they receive authorizations. And as I mentioned, we have put together a really strong and robust vaccine planning coalition of healthcare providers, our public health district, and the Office of Emergency Management to ensure that we're thinking strategically and critically about all issues relating to the distribution of vaccines. Anyone else have anything that they'd like to add to this at this time?
I think you did a good job of spelling out what is coming in the next couple of weeks with the 2 drugs that are coming out. They're a little bit different from each other. I think important to recognize that the way the vaccine is supposed to be administered has been decided. It is a layered or tiered approach to where do we start with vaccination, and then subsequently what are the next groups in a row, and it's quite detailed. And I will say it starts with healthcare providers, those who are on the front line in COVID units, ICUs, emergency rooms, those types of settings. And then it goes to, and this is very broad, but it goes to other healthcare providers, people at risk, and on down the list until ultimately we can offer the vaccine to everyone. So while very narrow in focus at the front end, I believe both of these companies are hoping to ramp up distribution of vaccines so that we can begin to reach out into our communities as quickly as possible.
Okay. All right, next question. If vaccines do roll out successfully, are there enough for everyone to take in the months to come? And can my job require me to take the vaccine? And could it become a requirement for employers in Waco?
I'll just field this one in terms of the legal requirements. I'm sure that attorneys for private employers are researching this. I think at this time, even the city as an employer is researching this as well, just to have clarity on the law. But I don't foresee a scenario where the city of Waco would pass any regulation or ordinance mandating private citizens or private organizations to obtain vaccines. I know that I've gotten some inquiries about that, and I don't see that scenario arising.
Okay. Anyone else? That's fine. That sounds like it answered it to me. So that's all the questions actually we received this week from the media and everything. But we do have 3 representatives from the media on the line. We have Drake Lawson on KWTX Channel 10. We have Rhiannon Sagert from Waco Tribune Herald, and we have Barry Roy from KCEN Channel 6 on the line. So let's go first with Drake Lawson. Drake, if you'll unmute, and what is your first question?
Yeah, Larry, can you hear me okay?
Hear you fine. Go ahead.
Perfect. This was kind of answered by Dr. Becker, but maybe just wanted to see if there was more information. I know this is all very fresh. As Mayor Meek was saying, you guys are learning more about it every day. But when the vaccines do arrive, are any of the vaccines going to be going towards nursing homes or people in the higher at-risk categories that we know if they catch this, there is the potential that they, that they could die? Is that going to go to those groups, or is it going to stay within the frontline healthcare workers?
Dr. Becker, do you want to?
I can take a stab and recognize that this is a very limited scope that I have. When we looked at the dosages that we will be receiving, we asked the question specifically. We have a senior living facility, Ascension Senior Living, that's a 300 plus bed facility. they will be receiving a supply of their own. So it won't come out of what's being shipped to the hospital. My understanding is they will be contracting directly with a pharmaceutical distribution to receive their vaccines. But that is a single place. That is the extent of my knowledge.
Yeah, and I would just echo that that's outside of the scope of information we've received from the state. All we're getting is just information regarding our organization.
I would just say that I don't know much more than what's already been said. Have not been told really anything additional that I would say is official, although it's my understanding that generally speaking in the Tier 1A, as outlined by the Advisory Committee for Immunization Practices, the ACIP, that nursing home residents should be vaccinated approximately around the same time as healthcare workers, at least frontline healthcare workers. And this is my general understanding, which I think that's sort of knowledge that the public also has access to, I believe.
Okay.
And just to echo what Dr. Wilson said, I know that our public health officials and Office of Emergency Management are continuing to work with the state to determine best practices based on the prioritization schedule that Dr. Wilson just referenced, based on the allocation that we can anticipate for our community.
Okay. Okay, Drake, thank you. We'll be back to you in a moment for another question. Rihanna Sagert from the Waco Tribune-Herald. Rihanna, you on the line?
Yes, and I have a question for the hospitals in general. Roughly how many vaccines would it take to immunize all frontline workers?
I can say that we have within our hospital 1,400 employees, and we have roughly 500 in our clinic system, and so that's a lot of frontline folks. If you talk about who is a frontline person, and I think people clearly recognize a nurse at the bedside and a physician, but we also have EVS staff who clean these areas. We have nutrition services who deliver these meals. We have lab people. So frontline is really stretches beyond what people may classically think of as a frontline healthcare provider into a lot of ancillary services that are involved as well. So while it may not be all 2,000 of those people would be on that front line, there is a significant number who are.
Yeah, and I would agree. So the short answer is it's more than the vaccine allocation we're getting initially. This is just the first installment. We will receive more. And within our organization, we're trying to discover and prioritize who is more at risk and to put those people to the front of the line. Something else I would say, rolling back the clock to 2008, when we had a pandemic with the H1N1 swine flu, it was not as severe as this disease. But if you'll remember, it did affect more of the younger population, and particularly pregnant women. And we did see a lot of hospitalizations, and we saw a number of deaths that year. And the global community was very involved, and we fast-tracked a vaccine. And if you remember that at the time of that vaccine coming out, because it was a bit faster than most vaccines, there was a lot of hesitation and nervousness about using this vaccine. And I hear a lot of people in the community expressing some doubt, some concern about the safety of this vaccine. I eagerly stood in line and received my H1N1 vaccine back in 2009. And I remember a lot of people saying, well, you go first. And I did. And I was happy to get my vaccine. And that vaccine was largely effective. And we have seen a dramatic reduction and only rarely see cases of H1N1 swine flu now. I am eagerly awaiting this vaccine. If there are others who need to go in front of me, I have no problem letting them go in front of me, though. It won't be because of my concern about its safety or efficacy. But I have largely adhered to the precautions that we preach each week, and that is wearing a mask and social distancing, et cetera. And I have spent hundreds of days dealing with hundreds of COVID patients and have fortunately not contracted the illness, as have many other frontline workers. So while we do want to protect them, if people will adhere to what we preach, they will have some layer of protection. again, we eagerly await the vaccine. We want the vaccine. We believe it's going to work. But know that if you're not getting the vaccine, doing what we've been preaching can be effective and can work for you.
Okay. Thank you, Rhiannon. We'll be back to you in a moment. Let's go to Barry Roy with KCEN Channel 6. Barry, you on the line?
Yes, I am. Can you guys hear me all right?
Doing fine. Go for it.
Dr. Mark, you kind of talked about this a little bit just there, but there are growing concerns around the world about the safety and the side effects of this vaccine. Many are saying that they aren't going to take it. Just getting everybody's opinion here. What would you say to the people of McLennan County that are concerned about taking this vaccine?
Any of the doctors on the line should probably fill this.
I can say one more thing. I've heard some people say, well, will it give me COVID? Can I contract COVID from this vaccine? And no, you cannot. It is not a live vaccine. It's not an attenuated vaccine. They are taking proteins that look like it, and they're synthetically making them. And that is what the vaccine is. And so it's a piece of the mRNA, messenger RNA, which is, I'll keep this simple, but think of it like DNA. So it's basically the subunits of its chromosomes. And again, I'm simplifying. And we are giving that, exposing that to your immune system and teaching the immune system, basically, this is the scent, this is what you go after. And so you cannot contract the illness. And I've heard people say, well, they're putting tracers in me, they can follow me. With this, that's not possible.
I would echo what, go ahead, Dr. Wilson.
Well, I should probably let you go first, Dr. Becker. You're probably going to say something smarter than what I would say, but I have not been in the medical field for decades. I have been a doctor for roughly 10 years now, and I have seen things. I've seen sort of punching bags come and go on social media. So at one point it was cholesterol medicines. At one point it was the flu vaccine. There's just things that sort of are in vogue. They're in and then they're out as to what is the devil here that the medical community is trying to sell us, that there is a conspiracy theory that we're not being told. And I can't, I think that this COVID vaccine, the hesitation about the side effects is another one of those, frankly. I know the data, and there have been phase 3 trials with tens of thousands of people enrolled in these studies that showed that they are safe. No, it's not that everything is 100% safe. We know that crossing the street carries its risks. Please, people in McLennan County hear that. Everything carries some risk, but let's not major in the minors. COVID is way worse than any small risk that may occur from getting the vaccine. And I would challenge anyone that is preaching about the risk of the vaccines to produce a good study, what we call a randomized controlled trial, or any study at all that reliably shows good, solid data of how many people have serious side effects from the vaccine. And you will not find one, despite some that may be presented in social media. There truly is not one. And Dr. Becker, I don't know if you have a comment.
I'd say anytime we give a medicine, there's a risk benefit that we weigh. And certainly with a vaccine that was produced quickly, long term, we don't quite know what that looks like long term, but I can certainly tell you what we see short term is a highly effective vaccine at preventing infection. So I think that's been clearly shown for both Pfizer and Moderna's vaccine. So I look at what's my short-term gain and my long-term risk, and the short-term gain is quite substantial with this vaccine. I think it's ultimately everyone's decision whether they choose to be vaccinated or not. And I think that we'll see some folks who will take it to protect themselves. I think we will see others who look at it as a tool that they can use to protect their family. So I'm going to be infectious for 2 to 3 days before I recognize that I have the illness. or more maybe. And so I think if I can do anything to protect my family, I'm likely to do that. So by getting a vaccine, I'm less likely to get infected. I'm less likely to infect others that I care about around me, that I work with. And so I think from a community standpoint, that's another way to look at this. It's not just about protecting you. It's about protecting those that you love around you.
If I could add one thing on, thank you, Dr. Becker, that sort of combines what I was saying as well as the comments from Dr. Becker. The side effect profile that we currently have is based on the data that we currently have. And so in a way that is an asterisk. We don't have data, years after someone got a vaccine and what side effects they may have had from that, because we haven't had a vaccine for years. It hasn't been years since we gave someone a dose of it. So obviously there's always, a caveat, always an asterisk. But I will say that generally speaking, and all prior vaccine trials, that generally speaking, across the board, if someone's going to experience a side effect from a vaccine, it's going to happen within the first 2 months of getting it, or really the first 6 weeks. And we just have not seen any substantial, any sort of trends or anything that's really truly reportable in the news of side effects that have happened within that usual period of 6 to 8 weeks, where the side effects usually happen from any other vaccine.
Okay, Barry, thank you for your question. We'll be back to you in a moment. Let's go back to Drake Lawson with KDBTX Channel 10. Do you have another question, Drake?
Yes, sir. I have one more question. It is regarding, again, more vaccine talk. I just wanted to ask this one maybe to Mayor Meek. I know that with this initial dosage, it's all very initial right now. It's all still going to the hospitals and going to those top priorities. But whenever it starts rolling out and we'll have a more availability to it, you mentioned that, the community right now is kind of working on a plan. Do you have any details to the plan or how that would be implemented, or any initial thoughts of whenever this will be given out, or where is it going to go within, say, the city of Waco or the community of McLennan County?
Sure, that's a great question, Drake, and a very fair question. What I do know is that right now, even every day, our health district and Office of Emergency Management learn more information from the state on the role that they will be able to play in assisting our community with the vaccine. And at this time, I don't have much new information beyond that. But what I do know is that we are committed to both accessibility and transparency in this process as a community. And I've asked these departments to work to ensure that our community is aware of that. And honestly, there are people in the community that in the Office of Emergency Management and our public health district that might have more information than I even do at this time. But I know that plan is in process, and have asked to ensure that that is communicated to our community as soon as we're able to do so.
Okay. Rihanna Sager. Rihanna, do you have another question for us?
Yes, and another one about vaccines for the hospitals. Because it's a tiered vaccine with 2 doses, is the plan to use the 975 on 975 people and then await second shipment, or divide those into tier 1 and tier 2 for half that number of people? Am I making sense?
Yeah, I understand the question, but I'm not sure what the answer is.
My understanding and our expectation at this point is to administer all 975 doses with an expectation of receiving a second dose in 21 days. So we won't be reserving half for the second dose, if that is the question.
Okay. Let's go back to Barry Roy with KCN Channel 6. Barry, you have another question?
Yeah, I guess here's my question about children in school. We've had a lot of school closures. With this vaccine, what are we looking at in terms of this getting to, children and making sure that they can continue their education without being in school, out of school, back and forth? Where do they fall on that list?
Dr. Wilson, you spoke to kind of the prioritization schedule. Do you know that?
I'm unfamiliar with, no, I'm not sure.
Anybody else? Barry, we might have to get you an answer to that. Again, I think the governor has released a prioritized schedule for distribution, and that is publicly available. So I don't recall where they fall exactly on that list, but that is something that is readily available.
Okay. Well, that completes our three questions for 2 rounds and things like that. Mayor, I might point out the fact that regarding the administration of the EOC of those, I know the Health District and the EOC several years ago, we did an actual live exercise and planning like the EOC does, and actually doing a mass inoculation practice. So I know that was done several years ago. So that's just one of the many plans that the city and certainly Office of Emergency Management has in their tool bag that they've already gone through. So I'm sure something, as you alluded to, will be similar to that. But it's not that we're not prepared, but certainly have been trained, and the Health District and the EOC both are ready to move on that, I think. So anyway, okay, that completes basically everything we have planned for our press conference until we let you, Mayor, wrap it up. And so I'll turn it back over to you.
Thank you, Larry. And again, I want to thank you to the participants in this call. We missed Judge Felton today, but hope to see him back next week as well. And miss Dr. Griggs, and hope to see him as well next week. So thank you for the participants, and I encourage our community to heed the advice of our doctors, and we'll see you next week. Thank you.
Okay, thank you. And I thank all you all for watching as well. We want to remind you that at 4:30 this afternoon, we will have a complete replay of this in Spanish. And you'll also be able to watch this at 7 o'clock tonight on our channel. If anybody's at work right now and wants to get a look at it, it'll be there. And we'll also have it on our video on demand as well. So you can look at it probably in about an hour. It'll take that long too. Another reminder, I know the doctors would probably want me to make sure we get your flu shots. Don't forget to take advantage of the flu shots and prevent yourself from contracting the flu. And we'll be back next week at the same time and to give you more information. And thank you for joining us, and have a good afternoon.